Welcome Tracy O'Carroll with HICA, who's presenting on patient experience, data for improvement and acute inpatient care.
Hi everyone, my name is Tracy O'Carroll and I head up the National Care Experience Programme, and I'm here today with Deirdre Hyland, my colleague from the Department of Health, who also works closely with me on this. So first of all, can't be seen. You can see it? The green. Right, well, while they're looking at that, I'll start. We don't have a patient or definition for patient experience, believe it or not, and that is the purpose of the National Care Experience Programme. So we tend to use the Beryl Institute's definition, which is that it's the sum of all interactions shared by an organisation's culture that influence patients' perceptions across the continuum of care. And as I've used this many times, but for one episode of care, a person using our services could meet 17 to 25 people. So we're trying to, the purpose of our role is to understand from their perspective what is their patient experience like. And it's very similar to what we're hearing here, so they do understand the challenges, etc., that we're facing. So, as you can see, the reason we collect patient experience is because it's a proxy for quality and safety of care. And Quigley did this research in 2021, and it's very American orientated in its language, but you can see it does lead to improved patient experiences if we've good quality care, obviously, and also provider satisfaction. And I know we're talking about workforce this afternoon, and you can see it does, better patient experience is a happier patient, but it's also happier staff and, and overall an organisation. So when we established in 2017, we established a governance structure, which was spoken about here, and this is very similar to what was discussed. So I should say it's a partnership approach between the Health Information and Quality Authority, and we are the regulator of service providers, but we also have a Health Information and Standards Division, and I fall under that. And we have the HTA, the Health Technology Assessment Unit, which we all knew about during COVID. We work with the Health Service Executive very closely, and they take the findings and they use the findings for improvements. We also work with the Department of Health, and they take the findings and it informs legislation and national policy. And in HICWA, we use it to inform standards, guidance and guidelines. So it was a sensible approach to have a partnership approach because we all wanted the same data but to use for different purposes. And every governance group, every time we meet, any time we do focus groups, etc., we always have patients or service users involved. So we don't go off on a tangent. So we very much, they're part of our memorandum of understanding. We have SAGE there and the Patient Advocacy Service. So we have, at a strategic level, we have a steering group with members of all the partner organisations, and they make decisions and they have oversight of the strategy. For each of the surveys that we run, we have an advisor group, and that has subject matter experts. Then we have the operational aspect and the team are based in HICWA. So we worked this strategy, and basically our mission is to drive sustainable improvement, and our vision is to drive sustainable improvement. But we provide the data. We are a national data set, and I'm here today to encourage you to come to us to use the data to drive that as sustainable improvement with whatever hat you're wearing today. We've got 4 key objectives. And we are working to, deliver on those objectives, and they include that we have national surveys and that we produce and provide the national surveys in an innovative and agile way. So in 2017, we started with the National Inpatient Experience Survey, and this was a survey that goes out to a population of about 30,000 people, the group that get discharged in 1 month in the year. And we asked them about their experience. That we got, I think, a 51% response rate in 2017. And the steering group decided it was so important and so insightful what we were being told that they would expand it to look at other areas. So since then, we've run the Inpatient Experience Survey every year. We ran the Maternity Experience Survey in 2020. We ran the National Nursing Home Experience Survey last year. We did the National Maternity Bereavement Experience Survey last year, and we have just completed the National End of Life Survey. And to the points that were made earlier, in the nursing home and the End of Life Survey, it's the first time in Ireland we are capturing what it is like in both public and private providers. So it's hugely insightful. And as I say, the data, we would encourage you to use the data. We are also developing a mental health survey and a cancer care survey. And we work closely with, all stakeholders across the nation to kind of develop up these surveys. I would say, again, to a point made earlier around governance, legislation, etc., we do, of course, have to meet all of these. And to make this happen, we have 75 data sharing agreements. And for the National End of Life Survey alone, it took us 2 years to meet the Data Sharing Governance Act of 2019. We had to go through a consultation. We work closely with the DPO and the Department of Social Protection. So it doesn't happen easily. And again, we looked at the Health Information Bill to help us to try and move faster in that capacity. So this is to assure you, it's very small, but we have a very, very structured, stratified way of developing each of these surveys. So if you were to use our data, which I hope you will, it is extremely, robust, and we can definitely stand over it. We get ethical approval. We have the information governance framework. We have we look nationally to see what's happening, we look internationally to see what's happening, and then we decide on the final model. And as I said, we have that advisory group keeping us on track all the way. So today I don't have time to bring you through the findings for all the surveys, so I've chosen the largest one, the Inpatient Experience Survey. But across the board, what I can definitely say is discharge is a challenge. And it's been a challenge every year. And I know from visiting nearly all of the 40 public hospitals that have taken part in the inpatient and the 19 maternity units and hospitals that take part in the maternity, everybody has made strides to improve that discharge experience, but still it remains low. So again, I would encourage further research to understand why is that. Communication is a huge issue. People using our services would like more time to talk to their doctors, their nurses, about their experience, about what to expect, about, what to expect when they go home, what to expect from the examinations, diagnosis, treatment, whatever is coming their way. And that is across the board as well for all surveys. So for the inpatient, we did 5 iterations since 2017. This particular survey looks at the experience across the continuum of care while in the acute providers. The maternity goes back, follows the women back out in the home and finds about the public care. The nursing home finds about the experience while, in residence, but also from the next of kin. So from here, we looked at the admission to hospital, care on the ward, examination, diagnosis and treatment, discharge or transfer, the overall experience, and the last 2 years we asked about care during the pandemic. At the end of each survey, we have a question, the qualitative questions, 3 open-ended, what was good about your care, what could be improved, and if you have any other comments. So for the inpatient experience survey, we invite everybody who's 16 years or older, who spent 24 hours or more in a public acute hospital to ask us about their experience. And it's all public acute hospitals take part in this survey. And this gives you a flavour of the age group. As you can see, over 50% are 51 years of age or older. And again, I think this very much points to the Brendan's kind of point from the SRI earlier in terms of the age group and the mix. We also ask what was the reason for your admission from their perspective. And you can see 21% say other, so it doesn't meet these. And we have tried to bring across the international classification codes from HYPE, but that's a different system than the systems that we're bringing in the contact data sets from. So that's very, very difficult and not possible really at the moment. So that's why we're doing it this way. But again, if we can make those data sets match a bit better, it would be a bit more informative, I think, for the people that we're trying to get this to. So there are, in 2022, there were certain areas of good experience, mainly care on the ward was really good. And you can see the kind of comments that we get from people. The comments can range from 1 sentence to 8 pages. You know, people are really, really want to tell us about their experience and want to tell us what they have advice about improvements as well. So from the moment I arrived in A&E to emergency room, the care and attention was excellent. And they tell us that most nurses were very caring and kind. And we get that across the board. The workforce, the staff, the catering, the portering are phenomenal, and it's really much appreciated. Where the challenges are, where they identify the challenges, is generally around processes and facilities. So looking at those 5 stages of care, as I said, discharge or transfer has stubbornly remained kind of the lowest area. For care, is that coming across? That discharge or transfer should be the 6.7. Sorry, it's gone askew in this. But the admissions is the first one, care on the ward is the second, examination, diagnosis and treatment is the 8.1, and then the discharge or transfer is the 6.7. And as you can see, it was getting better. And as I said, every hospital in the country was doing their best trying to improve this. And then I suppose COVID came, and this is what happened afterwards, and it went down again. And I suppose essentially people want more communication, what to expect when they go home, what's the side effects of their medication, who do they see when they go home, what supports are in place when they go home, etc. So this is kind of more detail on that. And as you can see, the last 3 areas are around the discharge or transfer and those areas of care that could be improved. So 31% said that they were not told about the danger signals to watch out for. And that's the third last one down. And the second one about provision of information to family members. Again, 28% said that their family did not receive all the information that they needed. And then the last one, information how to manage their condition. 16% said that they did not receive enough information on how to manage their condition. And perhaps digital solutions would help with this, because as I said, people actually want to speak with their kind of professionals and the people who are caring for them. So maybe they're not digesting everything that's coming at them at that time. So what can we think of around that? I just brought in the questions, the detail of the questions around that discharge or transfer. As you can see, we have quite a number of questions, 10 on that whole area. And the 5.4, you might see that there, question 45. Did a member of staff tell you about the medication side effects to watch out for when you went home, is the lowest scoring question. And it's fairly much consistent across the years that this is the lowest scoring question. So we need to consider what we can do about that. And then you can see the other areas there that are also quite low. 5.8, did a member of staff tell you about any danger signals you should watch out for when you go home? And I thought this was interesting as well. As you can see, the breakdown by age group. The younger age group have a poorer experience, and this goes with the overall experience as well, and the older age group. So that's something to consider, and also females have a poorer experience. So not only is this for discharge or transfer, this is also for the overall experience while they are in hospital. Medications, again, as I say, another area that we need to kind of consider. 36% of those who responded who received their medications said that they were not told about the side effects. So something to consider, what could we do there? And to give you a flavour of the kind of qualitative responses that we do receive on this is the care was very good follow-up care after I went home. The information about the aftercare and timeline of recovery was non-existent. The discharge, no information provided to family about the procedure or follow-up care, and no discharge papers. I had to keep calling my GP for scripts to go to the chemist. Sorry, I can't read this. But just to say, I'm focusing here on areas that we could potentially improve. There are huge complementary comments as well, but this is just kind of to think, how can you, with your hat on today, help us take the information and use it in whatever you're working on and to bring this area forward. So we did do a paper. We're very limited, like everybody, in resources, so we don't have a lot of time or resources to do secondary research, but we did do this. Dr. Linda Drummond did this one, and she looked at experience of shared decision-making in acute hospitals. And what she found is that, the comment was that nurses were always busy and seemed to be short-staffed at times, but they always had time to talk with you if you were upset or you wanted to ask questions. So basically, shared decision-making is really important, and that's because then everybody knows what the plan is before somebody goes home. But do people have time to make that, to do that shared decision-making approach? And that's what's coming across here, is that there is no time, basically. I thought you might be interested in this as well. This is about care experiences of older people in the emergency department. And lack of communication is one of the many challenges. And what was suggested is that, the emergency department should be, structurally divided into two, one for the older persons and one for the younger people. So that paper might be worth checking out. So I thought you might like a little flavour of the kind of comments that we have. And this is all about, I've shown you the evidence-based research that we have done, but it is limited. And we have an awful lot. We have over 100,000 qualitative comments. We have 5 years of surveys of voice of people using services coming back to us. And this is an example of how exasperated they can get being asked the same thing over and over again. And surely, in 2023, we're at a point that we shouldn't have to do this, that we should have their information available, and that we should be providing the customer experience and being able to, welcome them and just, reiterate or reaffirm whatever we have in front of us to make sure that's correct, rather than having to ask them again and again, what's your name, what's your address, what's your medical history, because that really just, those days should be gone. So this is my pitch to you. You can come to our website, yourexperience.ie. As I say, it's a partnership between the HSE, Department of Health, and HIQA, and we work closely with patients. You can find national, regional, local, team and technical kind of reports on that website. And we also have Tableau on the website. It's a bit tricky to navigate at the moment. But if you want to do any secondary analysis, that's the link there where you can find that. And then just to say, that's kind of the breakdown of qualitative responses that we have, because I know kind of the services find them extremely useful. And the point for us is, as soon as we do the survey, we have an online dashboard available, and we get those responses back to the service providers immediately. So they all have access to their own responses. At a national level, we have access to the responses, and we'd encourage you to use it as a secondary research level. And that's the email there, info@yourexperience.ie, or you could email me, tocarol@hiqua.ie. And that's me. Thank you very much.